with that, we'll move on to some discussion of some human-computer interaction projects and disparities in COVID. Chien-Ming Huang is a Malone professor in the Department of Computer Science who directs the Human-Computer Interaction Lab there. Chien-Ming, would you like to take it away and say a bit about what is going on?
Yes. Thank you, Greg. Thank you, Dr. Cooper, for the wonderful talk. I'm not really the main speaker today. I want to highlight students' projects. But before that, I want to just give people a bit more context. So a lot of concepts Dr. Cooper were talking about health equity, patient-centered, communication interaction, community-based research are really resonating a lot with what we are doing here in School of Engineering. So today we're going to highlight two students projects from my course, Human-Computer Interaction. And this is really the course that look at user-centered design. How can we design technological systems for people with diverse backgrounds? So we look at humans, diverse backgrounds, diverse needs, computers broadly defined, social technical systems, personal computer systems, mobile devices, data, and interactions. Really, these people interact with this growing diverse set of technologies. So a lot of things that we talk about in the class is human-centered design. How can we design systems that's equitable to users? How can we design systems that's accessible to people with diverse sets of needs and backgrounds? So very similar concepts in the health domain as well as in engineering domains. Also very happy to see that connections. So I want to highlight two projects today, and these are student-driven projects that look at really look at interactive visualizations to understand the disparity issues that we have seen in this current period of COVID-19. Wonderful teams from the class, led by Elle Park, as well as Carlos Aguirre. So I'm not going to take too much of their time, so I'm just going to pass it to Elle and then pass it to Carlos. And then feel free to ask questions along the way or toward the end. So Elle, please.
Thank you for the introduction. Hi, everyone. My name is Elle Park, and I'm an undergraduate computer science major here at Hopkins. And today I'll be presenting on various economic and mental health data to visualize the disparities and the impact of COVID-19. COVID-19 has really hit us all, and we've experienced loss, whether it's loved ones or the freedom to see people, hobbies, or jobs, like no other recent times. And there's been a major economic change with multiple businesses closing and millions of people behind on rent and facing evictions. And although we're hit with a universal cause of obstacles, it's very clear that the impact of COVID-19 is not being felt equally across the United States, as we've seen from Dr. Cooper's presentation as well. And there are huge disparities in infection rates, death rates, and socioeconomic fallout depending on race and pre-existing economic divide. The two graphs here visualize the data from the COVID racial data tracker by the Atlantic and from the CDC on the distribution of COVID-19 deaths and population. By the chart on the left, we can see that from the start, there's a clear disproportionate mortality rate across race, and it only continues to widen over time. Um, and the chart on the right is a dynamic depiction of the same data for COVID-19 deaths over time from March until November. African Americans and the indigenous population are much more heavily affected than the white and Asian population, and this gap only continues to grow. As we can see by November, the African American indigenous people have at least 1 in 1,000 rate of death, and this is quite alarming. And this stems from various causes of division that already existed in America long before March, and the pandemic has only made these divisions even more obvious. Next, we will discuss the root cause of these divisions, which is the existing economic disparities between the states and the counties in each state. This figure is based on the data from the United States Census Bureau sourced prior to the pandemic. And the heat map is based on state averages for the percentage of population under poverty level, with the darker color indicating states with the higher poverty level and the light higher percentage of population in poverty. So when we click on a state, we can see that there are two different counties with the lowest and the highest poverty level in each state. And by comparing the racial data in these states, we can see that in many states, the counties with less economic resources, such as access to the internet and availability of businesses, are also typically made up of more minority racial groups than the ones with more economic resources. For example, in New York State, despite being similar in population size and their proximity in geographical locations, Bronx County and Nassau County have a large economic disparity, with about 30% of the households are below poverty in Bronx County, just compared to 6% in Nassau County. And Bronx County is a majority minority county being made up of mostly Latinos and African Americans, whereas Nassau County is over 68% white. Access to economic resources is also directly reflected on the availability of internet at home. In Bronx County, 72.8% of the households have access, while in Nassau County, 89.2% of the households have internet at home. The next figure shows COVID-19 related disparities between counties in each state, similar to the chart before. And the state-by-state data for the incident rate per 100,000 people can be seen from the map. To see the comparison between the same two counties from the previous chart, you can click on the states. Again, in New York State, despite the similarity in the COVID incident rate, between Bronx County and Nassau County, the fatality rate in Bronx County is more than double that of Nassau County. And this data agrees with what we've seen from the first graph with the national averages for the mortality rate by race. Um, and this cause for this disparity can be attributed to the economic gap that's reflected in the percentage of population with and without insurance in the two counties. Again, looking at Nassau County, 58.9% of the population have insurance from employers, and only 5.2% of the population do not have any form of insurance. However, in the case of Bronx County, with a higher percentage of population under poverty, higher mortality rate, and higher minority population, only 29.6% of the population have insurance from employers, and 10.1% of the population do not have any insurance. And this highlights the varying degrees in which COVID-19 infection affected death rates alongside their respective racial makeup of the counties. Poorer communities and communities of color were struggling prior to the pandemic, and this has really only been exacerbated during the pandemic. Prior to the shutdowns and social distancing measures in March, Black and Latino populations still had higher unemployment rates compared to averages of all races, white and Asian population. But during and after the shutdown, they still experienced much more significantly higher unemployment rates. And continuing from the previous example, let's look at New York State again, particularly Nassau and Bronx County. Prior to the pandemic in the January of 2020, Bronx County had a 4.9 and Nassau County had a 3.6% unemployment rate. But in the midst of the shutdowns in April, they both shot up to 16.8% and 15.6% respectively. However, by August, Bronx County continued to struggle with rising unemployment rate at 20 to 21.2%, while Nassau County had a decrease all the way to 10.6%. Within a few months, Bronx County's unemployment rate doubled Nassau County's and remained extremely high compared to the rest of the counties in New York, which are mostly in the single digits for the unemployment rate. And this can be attributed to the fact that people of color are less likely to have jobs that can be done remotely, so they're more likely to be unemployed. Additionally, they make up a disproportionate number of minimum wage, frontline, or essential jobs, and these factors contribute to the high infection and unemployment rates that these communities are seeing. And finally, I was interested in exploring the discrepancy of the psychological impact of the pandemic. In my personal life, I noticed that people around me were struggling more than ever with mental health, with added stress and unexpected changes in their lives. And although the following study requires further validation with a larger study group, the outputs are still important to discuss and the culmination of all the socioeconomic factors for discrepancies amongst communities. That are being hit harder by COVID are experiencing higher depression rates during the pandemic. And even though there seems to be a consistent rate increase of depression symptoms throughout different ethnicity groups, there's still clear discrepancy in the increase of depression symptoms based on household income. Nearly half of the people with household income of less than 20K express depression symptoms, while less than 20% of people with household income of greater than 75K express depression symptoms. And as aforementioned, most low-income counties tend to be composed of people of color rather than white Americans. And while it's clear that everyone has been mentally affected by COVID-19, it's important to acknowledge that these communities have been hit worst of all. And a challenge that we face but go without a large discussion, is how we might be able to provide psychological support for these communities for the years to come to prepare for the damages done by the pandemic. Thank you.
Wonderful. Thanks, Elle. While we are transitioning to Carlos, do you mind to share the link for the people? People might be interested to just play around with your visualizations.
Sure.
All right, Carlos.
All right. My project, similar to Ellie's, it's also on visualizing the impact that COVID-19 has had on minority groups. Specifically, we gathered the data from 3 sources: the same COVID-19 tracking project, which collects the data from the state websites, the Economic Policy Institute, where we got the unemployment rates, and the KFF for the population sizes on minorities. Our first graph shows a regional-based view of COVID-19 and only the minority groups. This is meant to be more of an exploratory graph for people to, when they land in the website, to explore kind of what information we have. And we do see that the South and the Northeast have been the most impacted minority groups in our data set, but this has not been normalized or balanced by the population size. So to see a better view of this is the next graph on the cases and deaths by state. So when you land, you will see the COVID-19 cases per 1,000 people on the map, and these are balanced by 1,000 people in the state of each race. In total, we observed that the COVID-19 tracking project in the states do provide a variety of racial ethnic groups, coming from multiracial to Hawaiian Islanders, Pacific Islanders, people, Native American, Asian, Hispanic, Latino, Black, and white. A problem that I did fall into at the beginning, and that I do want to talk about or pinpoint, and something that Dr. Cooper mentioned in her talk previously, is the availability of data, and more specifically that it is not equal across the states, where like in some states they do provide data for Hispanic versus non-Hispanic. In other states they actually treat Hispanic as a race and they name it Latinx, and in some states they provide both. So it is really hard to standardize across the United States when each state has its own definition of what races they look like. But apart from looking at cases and deaths, what this graph or interaction allows you to do is to look at specific populations and how it has affected either deaths per 100,000 people or cases per 1,000 people. So say we wanted to look at deaths in the Black community across the United States, we can see first which states do not provide information, which are in North Dakota and Montana, but also where is the greater concentration of deaths in Black people in the United States. And we can see that the majority comes in New York. A fun, well, not fun, an example of how states do not provide data and how this is a problem is clearly seen in New York, where they only provide Asian, Hispanic, Latino, Black, and white information on deaths only. They do not provide this information in cases. And this is, again, a big problem because not only it's not allowing us to observe the data, but it's not allowing to provide nationwide analysis that are very important to keep track of our healthcare system, how it's performing. A completely different state is, for example, California, where they do provide racial, ethnic information for both deaths and cases. Recently, nationwide, we've seen an increase or a peak in cases and deaths of Native Americans. And we can see that in Pacific Islanders, but we can see that these two groups are the ones that majorly in the United States, we do not have data for. And this is, again, a big problem that not only, as Dr. Cooper said, it's been told to states or already incentivized by Johns Hopkins, but we can observe how this is a big problem in the United States. This has been becoming better, though. And if you look at the data at the beginning, I'm talking about the beginning of the summer, this was way worse. We had around 20 states where they didn't even provide at all data, split by racial ethnic groups. It wasn't until late fall or the beginning of fall where the majority of states now had racial ethnic information at the state level. And we're not even talking about the county level here, but this is just a view to observe the data that each state provides and what's missing and what we have available for. And again, this was data that has been collected from the states' websites and in contact with the states. So it is up to date until now. And the last view that I wanted to show, which is very similar to Ellie's analysis, is in the unemployment correlation with the COVID-19 cases. So this is a very similar graph that you saw in Ellie's website. And I'm showing the same, and just in a parallel view of unemployment. And you can see that why Americans have been less affected by COVID and by unemployment. But again, going down on the data availability, we don't even have data availability for some unemployment data for some racial ethnic groups like Native Americans. So again, I just want to point down the issue of data availability and how it has made not only my project really hard to do, but analysis on other projects that could be done nationwide are not available because of this. Lastly, I just want to mention like my ideas for the future for this website. I wanted to add an analysis done by Emma Pearson on the thresholds for finding whether the states are actually testing people at the same threshold for when each person has a when each person goes to take a test. People usually do try to measure this with test positivity rates. But in a recent paper she made, and she's made this analysis in other projects like police detentions and depression, for example. The positivity rates is not a complete measure on racial biases across the United States. So I just want to show with the data that we have in the future, another section where we add an analysis on the thresholds on when are people tested, to see that the thresholds are different per state. And maybe that's just one reason why we see these disparities in the United States, but that's a work in process right now. Thank you.
Thanks,
And I'll
Carl.
share the link on the website.
Wonderful. So very happy to see students channel their interest as well as what they learn in the class to the very important problems in our society right now. So I think we can take questions from the group if there are questions for the students. Or anything interesting observations.
Hi, this is Angela Purnell. I'm a faculty member in the School of Public Health. I really enjoyed both presentations from the students. I'm actually very impressed just by the level of detail and the passion and enthusiasm for wanting to correct what we know, are longstanding issues when we want to try and tackle these huge disparities. Often, we are faced with this issue of lack of data or inconsistent data. I guess my question for both students, so two parts. The first one is, what made you want to do this particular project? Like, what made you, really want to do it? In my experience, this is a field where you have to have some underlying passion to sort of tackle so many of the problems associated with this type of work. So what was sort of your motivation and inspiration for wanting to do this project in particular? And then part two is that if you both had an opportunity to meet with a policymaker at either the local or the state level, what would be your recommendations to those people in terms of what you think would be the most pressing and highest priority way to address some of these issues with inconsistent and incomplete data? Thank you.
I guess I'll answer question first. For the first question about like how to get inspiration from the project, I actually work with Carlos and Dr. Dredzi over the summer on visualizing COVID-19 health information. And that project had a lot to do with social distancing measures and how, like COVID data can be influenced from how, like the movement by people. But particularly I've always been very interested in mental health. So when I presented the idea that we look at how the pandemic has been influencing mental health, my teammates and I decided that we really wanted to take a look at the root causes of what could be affecting mental health, which are all these, pre-existing root causes of the divisions. And for the second question about like the suggestions for policymakers, I noticed that first of all, I noticed that there are inconsistencies for how much data is presented, both locally and nationally. Like for example, some counties are very open in the data they provide. They provide all the data from the mortality rate of all the races, and they update their data very quickly. But I noticed that in other cases, some counties don't really provide a lot of racial data or economic data. accumulated from the pandemic, so that I would suggest that there be some consistency in what data is being provided and how quickly it's updated across the nation. And I would also suggest that, well, I kind of mentioned this in my presentation, but I do believe that there's not really much of a discussion in mental health currently because physical health is so detrimental in the pandemic. Maybe it is a secondary focus, but I do believe that, mental and physical health are both equally important, and there should be more discussion, even in politics, about how politicians can help people take care of themselves mentally and physically, and get to spend time with families, because essential workers are being really hit hard by the pandemic, and it's clearly being shown in the data about how detrimental it is to them. So that's what I would suggest.
Thank you. Excellent.
Yeah, for me, my inspiration mostly comes from my, distant family members and maybe distant people in my friend group that do not believe in trends unless they see them themselves. And I had people in my family that did not believe that there were disparities in COVID-19, that it was, something that it affected everyone, and it does affect everyone. But I thought of doing this project mainly to show them the disparities, and that's kind of my point of view in designing the website. Is and everything, it was to show them that there are disparities in COVID-19 and that this is something that happens almost everywhere. So that's where I come from. And then also that my projects in data science analysis has been mostly related to disparities in racial ethnic groups and different demographic groups. So I already did research on this. So I just thought this would make a nice final project for Chien-Ming's class. And then what I would say to policymakers, again, just to reinstate what Elle said, was either from bottom up, from local to federal, or from top bottom. I do believe that there needs to be some sort of consensus on what data is a must, what data is needed. I think it is harder to analyze when some states do it, some counties do it, but some don't. So even if it was basic on, maybe the top X, my ethnic or demographic groups, and then have another category, or however it's feasible across the United States to do, there needs to be a conversation to have a consensus on to have similar data across the state. But that's just from my data science, data-driven mind. I'm sure there are better things.
No, that's awesome. I do thank you both. And as I mentioned previously, these are issues that those of us who do work trying to address disparities often face. And so I think it's excellent that you both are pointing out, things that we know to be very high priority issues across the board for multiple conditions. And I hope you both continue your work in health equity for a very long time. So thank you both.
Wonderful. Do we have more questions? I believe they shared the links for the group. Very interesting website. Encourage people to explore a bit more. I think it's a very nice way to just raise awareness of the societal challenges that we're facing. So if there's no further questions, I believe we are bound to have 15 minutes break, which is also very important. So we will be back 10:40. So see you all in a few minutes.